Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullah. I will talk today about acute lion pain. The lion pain is a common presenting symptom in general practice, and the potential underlying cause are extensive. The most common included UTI, renal calculus, and musculoskeletal problem. When I will talk about anatomy of the lion area in the abdomen, when I divided the abdomen to 9 regions, the flank is the side of the body between the rib cage and the iliac bone of the hip. When I have patient complaining of lion pain, I will start the assessment of the patient by taking history. Then I will ask the patient about when the lion pain started. I will ask about the onset, is sudden or gradually. Also, I will ask about the pain, if continuous or intermittent, and describe the natural of the lion pain, if stabbing, pain, burning, uh, colicky pain also. I will ask about association symptom, nausea, vomiting, if there is any aggravating or relieving factor, if the pain also affected by movement and deep inspiration, and ask also about the related pain to another area. Then I will do examination for the patient. When I do examination for this patient, I will see the patient by general appearance. If patient look ill, patient if on pain, then I will do pain assessment. I will do also the vital sign to check if the patient hypotensive, febrile, if the patient shock also, if the patient is dyspneic or no. Then I will do systemic examination. The most important one is abdomen. I will see if there is any skin rash in the abdomen, if there is any tenderness in the flank area, and if the abdomen is soft, lax, or acute abdomen. Then I will do other systemic examination. I will check the chest. I will check the back also. I will check the cardiovascular and other system and CNS. Then when I put the differential diagnosis for the patient with the lion pain, I will talk about renal causes and other local lion pain causes. The renal causes, the most important one is renal colic, and usually frequent came to ER with the renal colic. Usually the pain came with a sudden onset and severe pain. The patient came with the colicky pain also, and the patient complaining of pain radiated to growing. Usually, if it's stone that moving, patient maybe complain is more or severe pain than static stone. If the stone is large, does not pass in the ureter and lead to blockage the ureter and do the backflow to the kidney and do renal impairment. When I do investigation for this patient, usually 85% patient came with the hematuria from present with the urine dipstick or urine analysis. Also, I will talk about pyelonephritis, the another cause of renal cause for lion pain. The patient usually came with the frequency in the urine and burning micturition. When they look to the patient look is ill and high temperature. Sometimes came with the rigor also. When I do investigation for patient suspected with pyelonephritis, I found total white blood cell is very high and patient with biuria. The other cause is kidney tumor. The patient came with gradually the pain in the gradual onset and maybe painless hematuria. Also, I will talk about the renal infarction. The renal infarction, this is the frequency misdiagnosis. Initially, patient came as acute renal colic, pyelonephritis, or acute abdomen. Usually affected age about 65. The patient came usually with the risk factor also. The risk factor like hypertension, diabetes, patient a smoker, and also thromboembolism event like atrial fibrillation. Usually the renal infarction, unilateral flank pain and hematuria. There is symptom and most common symptom vomiting, nausea, and fever. When I do examination investigation for this patient came with LDH and white blood cell is high usually. Then I will talk about the other causes. The other local Loin pain causes dissection aortic aneurysm. A patient came with sudden and sharp Loin pain or abdominal pain, and the patient came with hypotension. This Loin pain usually similar to renal colic because the aneurysm adjacent to ureter sometimes cause hematuria due to irritation and trauma, and patient came with the same renal colic. The other cause is testicular torsion, also this important emergency. In the beginning of the testicular torsion, patient came with pain in the groin area, started, then radiated to the flank, the opposite of the renal colic. Usually association with testicular swelling and tenderness, the next step. When I saw the patient like this, should I send patient for testicular ultrasound emergency? And if testicular torsion is diagnosed, should refer the patient to general surgery or urology. Then the next differential diagnosis is herpes zoster. Usually herpes zoster, the patient came with pain, burning pain in the Loin area, and the pain is corresponding to dermatome. Usually the pain is preceding the rash, but if the rash is appear, the diagnosis is very easy for herpes zoster. Also, the cause is muscular pain. The pain is aging pain and discomfort, usually exaggerated by lifting or moving. Also, the causes of Loin pain is injury. Sometimes when the injury in the lower thoracic or upper lumbar nerve root will cause radiculitis. This patient suspected, when I do all investigation and imagining all within normal, then I will suspect this patient injury and radiculitis. Also spinal trauma for this patient when the fracture in the transverse process in the lower thoracic and the lumbar area will pain in the flank area. Also the appendicitis is the cause, can cause in the right flank pain. The pain usually radiated to umbilicus and also in the right iliac fossa. Usually the patient came with the high temperature and high white blood cell and CRP, and diagnosis and when do examination for this patient, usually abdominal tenderness in this area, right iliac fossa and right flank. When I do diagnosis for him by CT abdomen with IV contrast, if appendicitis, should refer the patient to general surgery. Also, there is pain, pleuritic chest pain, if pleuritic in the lower area, sometimes doing flank pain. The same of pleuritic chest pain, patient become dyspneic and pain is increasing when patient take deep breath. This is the other local Loin pain causes. Then I will talk about investigation. When I have patient with Loin pain, I will do investigation for him. Usually we started with the CBC and urine analysis. CBC, I will search about if the total white blood cell is high or normal. Then I will do urine analysis for him if there is any biuria or hematuria. I will do for him renal function test also. I will see if patient have any renal impairment due to obstruction of the renal colic or something. Then I will do for him also CT scan for CT abdomen, KUB for adult, and ultrasound for the pediatric when I searching about the stone and all. This is the image of the CT scan there is renal colic in this, and there is ureteric colic also appear in this CT scan. When I will do management for the patient with the lion pain, this management usually depending on the diagnosis and reach it to diagnosis. If I suspected the patient or reached the diagnosis of the renal colic, I will treat the patient with IV fluid and also painkiller. If the patient with pyelonephritis, I will start the patient treatment with IV antibiotic in the ER. Then I will send patient for internal medicine. If suspected the patient if renal infarction treated with IV heparin started, then refer the patient also to internal medicine. If the muscular pain, I will do local painkiller. I will do for him physiotherapy. Then according to diagnosis for each differential diagnosis for this patient, I will start the management in the ER. Thank you. I finished to talk about the lion pain. If there is any question,